If it is true, then it flows that you should be seeing a widespread in all of these regions where you are having all of these activities. If it is true, you should be seeing it. The data should be supporting it. The data does not support that. It's a nice argument to make, especially when you want to take politicians on, but the data is not supporting that. Second, the data as was mined by the Public Health Department of the Ghana Health Service shows us that we're having a lot more issues in offices and workplaces where you have enclosed activity happening. I'm sure you saw him present the data to you.
The Information Minister, Kojo Oppong Nkrumah, is, however, urging the country's security agencies and managers of enclosed areas to ensure strict adherence to the health and safety precautions to help curb the spread of the virus.
We will reiterate a call to the security agencies and to the managers, particularly of enclosed places, to ensure that compliance with the wearing of masks at least is enforced. All of us as citizens have a responsibility to ensure that the other parts of it, where, washing our hands, using of the hand sanitizer, we do it. But particular call goes out to the security agencies and the operators of enclosed places to ensure that the wearing of masks is enforced. So if you look at this particular slide, 1st to 14th of October, 432 new cases. And then in the last 2 weeks of October, that's where the challenge has been, 1,229 new cases.
Speaking at the COVID-19 press briefing in Accra, the director of the Ghana Health Service, Dr. Patrick Kumar-Buaje, bemoaned the increasing disregard for the safety protocols, particularly the wearing of nose masks in the national capital, Accra.
Mask wearing, appropriate mask wearing, had declined from 44.3% to 10%, and in some settings, 5%. Those not wearing masks at all had increased from 18% to 72%. Which is a major worry, and these are all in Accra, which is where the epicenter of the focus is. However, there has been some moderate increase in people who are wearing the mask correctly. What it tells us is that people are learning how to wear the mask well, but people have also stopped wearing the mask. And so I believe that if you're able to get people to wear the mask, more people will be wearing it correctly, and that will lead to better results.
Currently, Ghana's active cases stand at 1,156, with 320 deaths recorded. According to government, new sampling centers will be set up to facilitate contact tracing, testing, and treatment.
We want to establish additional sample collecting sites in Accra so that we can have more control and have more information. 2 will be in Accra and 1 will be in Tema, so that we can able to test and take all the information we want. We are going to repost surveillance officers in all these labs so that the initial information is taken from every potential person who has come there, whether you are exposed or you are traveling, you are going for testing. But even those who walk into the lab and want to travel, they are positive, nothing happens. They get positive and all they do is, okay, you can't travel now. But there's a lot that has to be done.